Welcome, everyone. Welcome to the launch of the Food is Medicine Institute. My name is Dariush Mozaffarian. As the inaugural director of the Institute, I'm honored to welcome you, both folks in the room in our packed auditorium, but also the hundreds of people who are joining us online. Thank you for joining for this live stream for this really exciting event. I'm just going to open with just introductions of four really remarkable people who are providing opening remarks about what we're doing here and why we're doing it today. First, you're going to hear from President Sunil Kumar, the 14th president of Tufts University. President Kumar assumed office of July 1st of this year, coming from leadership positions at Johns Hopkins, at the University of Chicago, and at Stanford. His own scholarship, quite appropriately for today, has investigated how one can build and influence systems to achieve societally valuable outcomes. I'm deeply grateful to President Kumar for his leadership and vision in supporting the establishment of the Food is Medicine Institute. President Kumar.
Good afternoon, and thank you, Dari, and thank you not just for the introduction, which is undeserved, but for leading this effort. So I'll say a few things. I will not pretend to know much about food is medicine. That is not my field. If you want to talk Markov chains, I'm happy to talk to you. But I wanted to say something about research and impact at Tufts and how this fits in that vision. At Tufts, we are a mid-sized university, about 1,000 faculty. And so we have to pick the areas in which we choose to go deep in and excel. And it's always dangerous for a university president to decide which areas this is. I only designate areas when I want them to die. Otherwise, you must look at where we already have strength, where we already have talent, and where we can use that to drive impact. The other thing we need to look at is how important is the problem. Sometimes in academia, we mistake the arcane and the difficult for the important. This is an important problem. Nutrition and food, nutrition as a substitute for medicine in a healthcare system that nobody will claim is efficient is particularly important. And so the combination of talent within the institution, importance of the problem, et cetera, made this an easy choice for this to be the first big initiative that I supported. And I couldn't be happier to see you all today and to be at its launch. With that, I may have overstayed my welcome, so I'm going to stop and thank you all and turn it back to Dari. Dari, congratulations.
Thank you so much, President Kumar. And the university is providing significant financial support over the next 5 years to really grow and build this area at Tufts and with a larger national network of partners. So we're really excited about that. Next, I'm pleased to introduce Provost Caroline Jenko. She is Tufts University's Chief Academic Officer. So she sets and guides all the priorities to advance our mission as a university that is student-centered and research-leading. I'm thankful to Provost Jenko and her team for their stalwart support and guidance throughout the development and launch of this institute. Provost Jenko.
Thanks, Dari. We actually started this discussion about food as medicine maybe 10 months ago, I'd say, something like that, where with Sunil kind of transitioning into the institution. And I'm thrilled at how quickly we were able to put it together, and we're actually formally launching the Institute. So I'm really thrilled to be here. Dari has a lot of energy and a lot of enthusiasm in this space, as I'm sure those of you who know him know. And so I'm just thrilled that we're able to actually be able to launch the Institute today. So one of the really important things about the launch of this institute is really that it's at a critical time when health disparities and lack of access to healthy food are significant drivers of poor health. I think all of you know that. We're really seeing tremendous momentum across both the public and private sectors in the US to really address this issue. And as many of you know, this is a major priority for the National Institutes of Health. We all know that Tufts is already recognized in this space, and food is medicine. And importantly, what we strive for here at Tufts, and I think the Friedman and Food is Medicine is a great example, is collaboration across both private and public sectors. All of you know, we like to say this all the time whenever we come to the Friedman School, that it's the only school of nutrition in the United States. And we really feel that the Institute is going to really broaden the impact of the Friedman School by collaborating across all of our schools, and in particular with one of our very important partners, and that's Tufts Medicine. And you'll hear from leadership of Tufts Medicine later this afternoon. So I just wanted to talk a little bit about what the Institute is planning on doing. I know Dari's going to talk a little bit about that. You know, there are kind of a number of different areas that the Institute is going to touch upon. And I think the focus will be to develop a center of excellence that can be responsive to the NIH and the call for work in this area. First, it's going to integrate food as medicine into electronic health records, clinical care pathways, and referral systems. Really, really important. It's going to provide interdisciplinary training for not only physicians, but scientists and healthcare professionals. It's going to lead clinical interventions like medically tailored meals, groceries, and produce prescriptions, combined importantly with the education on how to use those. It's going to engage with public health advocates, importantly, community members, and the private sector. And importantly, what the Friedman School does so well is to develop policy. And it's going to be policy that really advances food as medicine across the university and across the country. So we're really thrilled that many of you who are partnering with the Institute are here to join us for this launch. I know you're going to be working collaboratively over the next year and years ahead in developing projects, seeking joint funding, partnering with us on education and advocacy, and importantly, creating this network that really will have collective impact. So before I turn it back to Dari, I just wanted to thank all of you. This is really a team effort. It's a team effort with the faculty and the students in the Friedman School. It's a team effort with the School of Medicine, with our partners at Tufts Medicine, as well as our collaborators, both private and public across the country. And then finally, really a partnership with our communities. I think it's critical, and that is something that's really unique about Tufts. It's our ability to have an impact in both our local and our global communities. So welcome. I'm thrilled you're all here. I'm thrilled to see the next phase of the Food as Medicine Institute here at Tufts University.
Thank you, Provost Jenko. Next, we're going to hear from two remarkable and dedicated deans. First, you'll hear from Dr. Christina Economos. She's the Dean of the Friedman School of Nutrition Science and Policy, and also the New Balance Chair in Childhood Nutrition. Having worked really closely with Dean Economos in a variety of ways over nearly a decade now, I can think of no one better to be leading the Friedman School in its mission of creating future leaders, real-world impact, and trusted science. Dean Economos.
Welcome, everyone. So my role is to welcome you all to the Friedman School and the launch of what I think is the first, but will definitely be the best, Food as Medicine Institute. So as you heard, we're the only school of nutrition in the country, and now we have one of the only, if not the only, Food as Medicine Institutes. And I can't think of a better place to build something like this. We have a reputation at Tufts as being entrepreneurs. There's an incredible history and entrepreneurial spirit at the university. I'm a builder, Dari's a builder, and I think you've seen both of us, if you know us, build things through the years, and I know that this will be incredibly successful. And the launch of the center is really an important step in our ambitious strategy here at Friedman to enlarge our research and training portfolio and to integrate evidence-based food and nutrition science into healthcare, and importantly, to inform policy at the national level. And the work of the center will help link our health sciences schools together. We have an incredibly rich campus here with multiple schools, and you're going to hear from the dean of the medical school, but this will go beyond and really link all of our schools and provide opportunities for our colleagues and students on the Medford campus to get involved as well. And I think not only high impact research will come out of this, but also opportunities for experiential learning, for working with people on the ground, doing community engagement, learning from people with lived experience, and training to achieve cross-country impact. So I really look forward to supporting the faculty, staff, and students to build this institute, supporting Dari and working with him every step of the way. And I think it really is a moment where we're finally valuing food and nutrition in our public health system and in our healthcare system. And I'm really excited in terms of the future together. Thank you.
So next you're going to hear from Dr. Helen Boucher by video. She was not able to be here in person, and so she sends her regrets as she had a previously scheduled trip and is going to be giving recorded remarks. She's Dean of the Tufts University School of Medicine, and she also plays a role across the larger Tufts Medicine Health System as the Chief Academic Officer, so both integrated into teaching and clinical care. And in her own work and in her role, I think, as a leader at the Tufts University School of Medicine, Dr. Boucher is a champion for advancing health justice and addressing the healthcare inequities that plague our nation. And so I welcome remarks from Dr. Boucher.
Congratulations, Dari, on the launch of the Food is Medicine Institute. What an exciting and noteworthy step forward for Tufts and our patients. I applaud your vision to advance science and translation for a food system that is nutritious, equitable, and sustainable. We know that poor diet causes over 300,000 deaths from cardiovascular disease and diabetes, and 80,000 excess deaths from cancer every year. In our state of Massachusetts, 1 out of 3 face food insecurity, and these problems are much worse in marginalized populations. Tufts University School of Medicine and Tufts Medicine are excited to partner with your institute and team to decrease the burden on our healthcare system and deliver care in ways that include nutrition interventions that are optimal for patients and impact outcomes. This includes educating our workforce in health justice and healthcare delivery and implementation science. We are already collaborating to recruit experts in nutrition science, community engagement, and more. Once again, congratulations on the launch of this great institute. Have a great meeting.
So you've heard a lot about kind of the background of why we think this is important, but I want to just spend a few more minutes before we turn to our really exciting panels to tell you a little bit more about the Institute and why we're creating it. And I think one of the most exciting things that's happened is as we started to discuss this before today's public launch with colleagues and partners and collaborators and funders, there's been so much internal and external interest in the Institute and in working with us. And that's good to hear because sometimes you get really excited about something in your own little bubble and nobody else cares. As the president said, the arcane and the difficult may not be the important. But I think in this case, this is also really important. And this incredible external and internal enthusiasm, I think, has supported that, as reflected by the people who are here in the room and those who are online. And so, as we think about food as medicine, there's several ways to think about this. But the way the Institute is going to approach this is to think about food-based nutritional interventions integrated into healthcare to treat disease and advance health equity with supportive policies and programs at the population level and in federal nutrition programs and so on. But really, the core focus is how do we actually get food into healthcare, nutritious, nourishing food into healthcare. And so first, thank you to our supporters, to those that have supported us to get here and continue to support us now. All of the organizations and funders listed here have provided support, funding support in different ways for the work of the faculty of the Institute. And we would literally not be here talking about this without them. So very, very grateful to all of the funding supporters here. Why do we care so much about this? Because this is such a major cause of death. As Dr. Boucher said, over 300,000 deaths from cardiovascular disease, over 80,000 deaths from cancer. If you add deaths from other conditions, over 500,000 deaths per year in the United States, directly attributable to poor nutrition. So 10,000 Americans dying a week because of poor nutrition. And what this graph shows is an analysis that we published looking at some of the top nutritional causes of poor health. And you can see there's things like low fruit intake, low vegetable intake, low intake of nuts and seeds, high sodium, high sugar sweetened beverages, and so on. The real point I wanted to make here was that I sort of highlighted what are deaths from harmful factors, from having too much of bad things, and what are deaths from insufficient protective factors. And there's more deaths from insufficient protective factors than from excess harmful factors. That's really important because the way we've approached food in the last 30 years with the obesity and diabetes epidemic is something negative. It's something that we have to worry about and get concerned about and have less of and reduce and limit and restrict and tax and have warning labels. And that's true for some limited things, like maybe sugar-sweetened beverages might meet all of those metrics. But once you get beyond sugar-sweetened beverages and maybe really high sodium foods, those kinds of policies don't work to increase the intake of the healthful foods. And that's really what's missing. And that also restores a positive relationship of people with food, restores a positive relationship of people with farms and farmers and grocery stores and people supplying the food. We don't have to have a negative adversarial relationship with the food sector that's feeding us. That should be a positive, nurturing relationship with the food sector. And so food as medicine is really about the blue, right? How do we get the healthy food to people that need it most? And on top of poor nutrition and all of the deaths and disability and suffering from poor nutrition, there's also, of course, dire and very unequally distributed food insecurity in our nation. And food insecurity isn't exactly the same as poor nutrition, but they overlap quite a bit. Those folks who can't access, pay, afford, get to be able to prepare healthy food also often have the worst nutrition and the highest rates of diet-related diseases. And we talk a lot, and we should talk a lot about the lived experience of families with hunger and food insecurity. And those same families have lived experiences with diabetes, with amputations, with renal failure, with heart failure, with blindness. These are challenging diseases that I see as a cardiologist. And so we have to also think about this. And what's exciting is food as medicine addresses both poor nutrition and food insecurity. And there's very few interventions that I think can have that sort of double benefit. And I'm showing you now a map of the US rates of diabetes. And look at the overlap, right, between food insecurity. And there was another couple of maps I found on poor quality diets. Again, a real overlap here. Not a coincidence that the same areas of our country that are suffering from food insecurity and poor nutrition have the highest rates and highest suffering from diet-related diseases, in this case, diabetes. And the societal costs beyond the individual people and the individual families and their personal and suffering, the societal costs are incredible. And so from one analysis from Tufts, an estimated 750,000 Americans died in COVID-19 that wouldn't have died if we had a metabolically healthy population, because diabetes, obesity, hypertension were the top causes after age of death and hospitalization with COVID-19. So we lost 750,000 citizens because of metabolic disease during COVID-19. And if you put together the economic costs of food insecurity and poor nutrition, and this is an analysis from the Rockefeller Foundation, we have Devin Clotel from Rockefeller here, they published this great report. It's estimated that $1.1 trillion is lost in the economy every year, trillion with a T, way more than Congress is arguing about in budget discussions and things and how to change the budget. $1.1 trillion a year is lost from economic costs of healthcare spending and lost productivity from poor nutrition and food insecurity. And so food as medicine is not going to be the only answer to all of these problems, but it's one core answer. If I had to pick sort of a top 10 things to do to address everything I just discussed, food as medicine is definitely up there and probably up there in the top 3. And this is one way to envision food as medicine. It's a pyramid of interventions with at the top the most intensive interventions like medically tailored meals, fully prepared meals. You're going to hear from a patient who's received these, down to produce prescriptions if somebody is not quite that ill but can shop and cook, getting healthy produce. You're also going to hear from a patient who's been involved in these programs, down to improving our federal nutrition programs and thinking about population level programs. All of this integrated into healthcare and healthcare systems with nutrition and culinary education. And so this is not some crazy pie in the sky idea. This is actually starting to happen, and this is what's really exciting. As I mentioned and has been discussed, food as medicine is not just a medical treatment. It's a medical treatment that can advance health equity. And as a cardiologist over my career, I've seen so many incredible advances in cardiology. Valves that can be put in through veins, new drugs, new stents, new devices, pacemakers, all kinds of changes in critical care. All of those innovations have been remarkable and have saved lives. And there's always remarkable disparities in who receives those interventions. And the folks who need it the most often receive those interventions the least. And so we are improving health, but we're also often worsening disparities with most innovations in healthcare. Food as medicine is exciting because it's the first real innovation I've seen in my career, meaningful major innovation in healthcare that can actually improve health and reduce healthcare disparities by going to people and focusing on people with social needs, food insecurity, financial strain, other challenges. And as already mentioned, it also addresses food insecurity and nutrition insecurity, which is a wonderful, amazing 1-2 punch. Now, this is not yet as well established, and this needs more work and needs more thinking, but food as medicine can also, if done right, advance other priorities we have for our nation, advance priorities around strengthening local and regional food systems, supporting local farmers, even prioritizing and supporting certain farming practices like regenerative farming practices. And so there can be this beneficial loop of beneficial forward loop of positive progress for not just health and the economy, but also for farms and for our food sector. And if this sounds, well, like could food as medicine really do all that? I mean, remember, healthcare is $1 in $5 in our economy. We're not talking small change. $1 in $5 that we all spend on average goes to healthcare. So if we take a small portion of that and turn it toward food as medicine, there are many, many downstream potential benefits. And as I said, this isn't just us thinking about this. There's many organizations, many government policies, many actions going on across the nation, from clinical societies to President Biden and his national strategy, to healthcare organizations, to entrepreneurs, to nonprofits. There's so much going on in this space. And most of what's on this slide is like the last 2 years. So this is this incredible, incredible acceleration of food as medicine in the nation. And so I'm really excited about the Food as Medicine Institute. Provost Jenko talked about what we're going to focus on. We're going to focus on clinical research and implementation, education and training of the next generation of scientists in this area, ways to improve patient care in food as medicine, community and private sector engagement and policy development. And we're not starting from scratch. In green is some examples, just a handful of examples of the many projects that were already ongoing and accelerating at Tufts around food as medicine. And so I just want to end by thanking not just our funders, but also our many partners. And I apologize if this list is incomplete. I made the slide this morning, thinking about all of the great, thank goodness for the web and logos, all of the incredible partners that we work with that have really helped move this field forward. And so this is, again, just a cross-section of the groups that we're working with and how exciting it is. And you're going to hear from some of them today during the panel. So thank you for your interest. Thank you for being here. I really look forward to working together to advance food as medicine, and I'm looking forward to the rest of the day. Thank you.
Very exciting remarks. Good afternoon, everyone. My name is Fangfang Zhang, and I'm associate professor and chair of the Nutrition Epidemiology and Data Science Division at the Friedman School. In the past few years, I had the privilege to work with patients, healthcare providers, community-based organizations to evaluate food as medicine programs. In our recent large-scale evaluation, we found that the patients participating in produce prescription programs had promising benefits. Currently, I'm co-leading our multi-center randomized control trial to evaluate the impact of medically tailored meals among vulnerable patients with cancer. My colleagues and I also are evaluating a pilot program to implement produce prescription programs in prenatal care clinics at Tufts Medical Center and the impact on maternal and the child health outcomes. So I look forward to continuing this line of research with the Foodist Medicine Institute. So I would now like to introduce our next two videos. Our keynote address by Secretary Tom Vilsack of the United States Department of Agriculture, and remarks by former U.S. Senate Majority Leader, Senator Bill Frist. Secretary Tom Vilsack was confirmed as the 32nd United States Secretary of Agriculture on February 23rd, 2021 by the U.S. Senate. He was nominated by President Joe Biden to return to a role where he served for 8 years under President Barack Obama. Secretary Vilsack is spearheading a transformation of the food system by creating more, better, and fair markets and ensuring that food system of today and the future is more resilient and more competitive globally. It will also offer consumers affordable and nutritious food grown closer to home. Senator Bill Frist is a heart and lung transplant surgeon and the former United States Senate Majority Leader. He currently serves as the chair of the Global Board of the Nature Conservancy, the largest conservation organization in the world. He represented Tennessee in the U.S. Senate from 1995 to 2007. His leadership in the U.S. Senate was instrumental in the passage of the 2003 Medicare Modernization Act that established the Medicare Advantage and Medicare prescription drug benefits, and also the historic PEPFAR legislation that provided life-saving HIV treatments globally to 25 million people. So without further ado, let's turn our attention to both of their remarks. Thank you.
Thank you for inviting me to speak at the launch of Tufts Food is Medicine Institute. And congratulations on this exciting announcement. As Agriculture Secretary, I have the privilege of leading the department that plays a major role in ensuring that people across the country can access affordable, nutritious food. The mission of food and nutrition security has long been a foundational piece of the work we do here at the People's Department. At USDA, we take seriously the charge of feeding the American people and the world. But not only that, we have a responsibility to ensure those meals are healthy and nutritious. I don't need to tell this group how important nutrition is to overall health. You know what we at USDA also know. Good nutrition can prevent serious illness and improve health outcomes. The Biden-Harris administration knows this too and has launched notable efforts that center nutrition in its policy work. President Biden's Cancer Moonshot effort to end cancer as we know it recognizes the value of nutrition in the prevention of cancers. In fact, research shows that 30 to 50% of all cancers are preventable through healthy eating and lifestyle changes. This focus on nutrition extends beyond cancer prevention. Last year, President Biden called together hundreds of stakeholders at the second ever White House Conference on Hunger, Nutrition, and Health, the first such conference of its kind in over 40 years. And one of the conference goals outlined as a strategy was to prioritize the role of nutrition and food security in overall health, including disease prevention and management. Over the past year, USDA has worked diligently to build on the conference's momentum and advance its goals. Shortly after the conference, we announced the Agricultural Science Center of Excellence for Nutrition and Diet, or ASCEND for Better Health Initiative, which brings together scientists, partner organizations, and communities to deliver science-based solutions that promote food and nutrition security for all Americans. And just last month, we announced the first physical nutrition hub as part of the ASCEND initiative. Located on the campus of Southern University in Baton Rouge, Louisiana, this hub will help community members understand and integrate healthier food options based on the latest science. Earlier this year, we announced a proposed rule to improve the nutritional content of school meals, by reducing the sodium content, increasing the amount of whole grains, and for the first time ever, proposing a standard to limit added sugars. And we recently awarded $30 million in subgrants to 264 school districts through the Healthy Meals Incentives Program to support them in improving the nutritional quality of their meals and modernizing their operations. We've also invested millions of dollars over the years in competitive grants to help schools update and modernize their cafeterias to be able to better prepare and serve healthy, nutritious meals. Now, WIC is a critical public health program that serves nearly half of the babies born in this country and provides pregnant and postpartum women, babies, and young children with vital nutrition. We know this program has an important positive outcome on maternal and child health, and we proposed a set of changes to make the food package even healthier and to align with recommendations from the National Academy of Sciences, Engineering, and Medicine. And our Gus Schumacher Nutrition Incentive Program, or GUSNIP, provides funding for projects to incent the purchase of fruits and vegetables by SNAP participants, as well as a produce prescription program. Now, we've also strengthened our SNAP nutrition education program, creating a first ever dedicated branch at FNS led by a team with a background in public health nutrition. This is going to enable us to implement, evaluate, and scale up evidence-based approaches to advance food and nutrition security, reduce diet-related chronic diseases, and promote equity. Nutrition is at the core of what we do every day at USDA, but we cannot do it alone. That's why I'm so excited about your new Food is Medicine Institute. Our powerful programs like WIC, SNAP, and the National School Lunch and Breakfast programs can help improve public health, reduce multiple visits to the emergency room, and prevent or mitigate costly chronic health conditions. Yet many who are eligible for our suite of 16 federal nutrition assistance programs are unaware that they qualify for assistance. This is where the healthcare sector and your institute can help. Play a role in leveraging your position as trusted messengers to get the word out about our programs and help connect them with those in need. Together, we can maximize the reach of our federal nutrition safety net while also addressing food insecurity, improving public health, and reducing healthcare costs. I look forward to seeing the good work you're going to continue to do to improve the health of all Americans. Congratulations on the launch, and I look forward to working with you in the future.
There's nothing more exciting than giving birth to a new concept, a new idea, a new approach, especially when we know it will definitely accelerate science and understanding and policy and potentially benefit every single person in this country and beyond. You know, policy matters. When I was in the Senate as a doctor, I worked on this very issue, but it was not until 5 years after I left, back in 2010, when Medicare first approved reimbursement for a food-based intervention. It was in my own field of specialty, the heart, and it was for intensive cardiac rehabilitation. And then you jump forward to now, more than half of all Medicare Advantage plans offer some type of meal benefit. And of course, we were all excited for the White House to signal nutrition as a policy priority with last year's conference on hunger and nutrition and health, the first of its kind in over 50 years. But you know, we're just in the early stages. We're in the initial stages, particularly when it comes to genuinely integrate food and nutrition more seamlessly into healthcare. We all know the data. We know how important food and nutrition are to ensuring the opportunity for a healthy and fulfilling life. But poor nutrition continues to be one of the greatest health-related challenges we face. It's no secret that our health and well-being here in the United States suffers in large part due to diet-related diseases. We all know the data. The numbers are clear. Each year, there are over 300,000 deaths and more than 80,000 new cases of cancer that can be attributed to poor nutrition. And when it comes to cost, the healthcare costs for diet-related chronic diseases cost Americans over $1 trillion every year, year after year. Using nutrition backed by extensive peer-reviewed research we know we can prevent and treat diet-related disorders. And the good news is that we're already seeing hospital systems and health plans and doctors and practitioners waking up, becoming more involved in food interventions. But at the same time, we know we can do better. We can use food and nutrition more intentionally to lead to even more healing, better outcomes. And that's why this initiative is so important as a resource to the country to accelerate, to speed up, to catalyze what we know is fundamental to health. This institute will lead to improved health outcomes. It'll lead to better health equity. It'll lead to reduced healthcare costs across the board. And all of these together are what value-based care is really about. And that's why I'm excited to join you all today as Tufts launches the new Food and Medicine Institute. I commend Derry and the team and all the partners for their disciplined focus on improving nutrition research and on driving this much-needed change. Congratulations, and I look forward to working with you all in this next truly dynamic chapter.
Good afternoon, everyone. My name is John Wong, and it's my pleasure and honor to introduce the first panel. For everyone in the room, I will say that Dari's enthusiasm and excitement are palpable in this room. He's actually quite contagious. This feels like a moment of inflection for food as medicine, nationally and internationally. I will say, as the chair of the Division of Clinical Decision Making here at Tufts Medical Center, our team-based research projects and collaborations with Dari, Fang, who you just met, and other colleagues have been able to translate evidence-based dietary and nutritional interventions for policy into projections for their impact on U.S. public health. It shares my mission as a member of the U.S. Preventive Services Task Force to help all people in this nation live longer and healthier lives. With that, I would like to introduce our first panel, Food as Medicine's Impact on the Community. And I would like to invite all panel members to come forward and have a seat in the chair. And for me, this is one of the most important panels because this is where the activities actually impact people's lives. This panel will feature voices of individuals most closely engaged in food as medicine initiatives, including patients, community members, and those with lived experiences. Our panelists include NutriCare participant Ruth Comer, Brent Ling, who is Director of External Affairs at Wholesome Wave, Produce RX participant Alice Mejia, Julian Miller, co-founding director of the Reuben V. Anderson Institute for Social Justice and assistant professor of political science at Tuvalu College. The panel will be moderated by director of the Food as Medicine Institute, Dari. Ruth Comer's experience with cancer began 27 years ago when she was faced with a bladder cancer diagnosis. She has long fought hard and has gained invaluable insights into the significance of nutrition and its profound impact on well-being. Brent Ling is Director of External Affairs at Wholesome Wave, where he oversees their public health research initiatives and policy advocacy projects. This includes serving as Program Director for the National Produce Prescription Collaborative, where many of us collaborate to more fully integrate the produce prescription model into standard clinical practice. Alex Mejia is a devoted mother. She was asked to be part of the produce study, and this has been a great help in helping to change her and her kids' eating habits by incorporating fruit and vegetables into their meals. I'll just add that her 2-month-old son is here in the audience. The experience has changed how she and her family view food. Attorney Julian Miller is the co-founding director of the Reuben V. Anderson Institute for Social Justice and Pre-Law Program and an assistant professor of political science at historic Tougaloo College. In his role at Tougaloo, he is also the co-principal investigator with Dr. and now Dean Chris Economos of the Delta Greens Food as Medicine study in the Mississippi Delta as part of a 5-year, $6.6 million NIH-funded grant that has forged a partnership between Tufts University, Tougaloo College, and the Reuben V. Anderson Center for Justice and Delta Health Center. Please join me in welcoming our panelist, and I'll now hand the podium over to our session moderator, Dari.
So first, a welcome to all of you. And I want to turn to each of you and ask just the very general question of your own experience in this field, wherever it may have come from, around food as medicine, and why you think this area is important. And so Ruth, we'll start with you. You live in Columbus, Ohio. In February of this year, you were diagnosed with stage 4 metastatic lung cancer. And had lost about 10% of your weight, and you're not a giant, and so 10% of your weight is a lot. And about 2 months after your diagnosis, heard about and enrolled in a Tufts project, the NutriCare study. We just want to tell me about your experience before, after your diagnosis, leading up to getting enrolled in the study, and then what your experience was like on the study.
Well, at the beginning, I noticed that my left arm was hurting. I went to the doctor. I was losing weight also, and I was fatigued. I went to the doctor, and the doctor didn't think anything was wrong.
Just hold on.
Oh, the doctor didn't think anything was wrong, so it took a while before that they did give me an x-ray. Once I received the x-ray, they saw that I had a mass, a large mass, stage 4 cancer in my lung. I'll start treatments, I say about a month or a little bit more than a month after. At my first treatment, I was told about a study and would I like to join into this study, which I said yes, and I joined the study. I had lost quite a lot of weight. And this was a food study, nutrition. Once I got into the study, I found out that I was receiving food. I received the food, didn't have to pay for it. Well, food was already cooked. Did not have to cook, which helped out a whole lot. And the food was good. And I enjoyed the food. I started gaining weight, but at times I did lose weight again. And I also was fatigued. But the food and the treatments, as I went longer, it started happening, started working. I gained more strength, I gained weight, and everything started improving. Now I have, my mass have shrunk more than 50%. And it's just like a matter of months. And I know it also had to do with the food and the nutrition because it made me stronger. So I was able to fight the cancer. And I am very happy about the study that I am in.
So the program that the NutriCare study funded by the Bristol Myers Squibb Foundation is enrolling patients, randomized trial from across the country with metastatic lung cancer to test the impact of medically tailored meals. Those are provided by mail by MANA in Philadelphia, which is one of the Food as Medicine Coalition partners, along with Community Servings here in Boston and others. Can you talk about, beyond the meals and the prepared meals, the role of nutrition, counseling, and guidance that you received as part of the study? Cancer patients can't receive reimbursed counseling by an RDN, right? It's just not, it's not reimbursed. If you have cancer, you have to pay for it yourself, or you can't see one. But in the study, she was able to get RDN counseling. What was that like, and was that helpful?
Yes. For one thing, I did not have to cook. I got counseling that was telling me what foods I should be eating. I received counseling each week by phone, which was very helpful because she told me certain foods and different things I didn't even know about. And also she described ways of eating that I didn't do. I was only eating most of my whole life. I just only eat about one meal a day. And she informed me about, different foods I could eat, things that would be really nutrition that I didn't know about. And it really did help out a whole lot. Also, the payment, for food and stuff like that by getting it free, if the government and your insurance company would put in a little bit more, to help out, that would also be good, because a lot of patients, cancer patients, they don't have the money or even ways to, get to the grocery stores and things like that to get food and stuff. But if it was like the government would come and help out with more allowance and things for some cancer patients, and they do help with some of the patients, but still certain patients like don't receive enough allowance and things like that for the food.
Well, thank you for coming from Columbus to here to tell your story, and we'll come back to you for a second question on kind of what you would like to see in the healthcare system. Maybe next we'll go to Brent, and then come back to Alice, and then to Julian. So, Brent, tell us a little bit about yourself and your role, and kind of what you see and what you're excited about in Food as Medicine.
Thank you, Dari, and I'm very happy to be here on this panel. Thanks for the invitation. I think our story at Wholesome Wave isn't particularly unique to anybody in this room. We believe in the world changing for the better, and we do that through food. We do research programs, and we assess ways to bridge the gap so that folks, no matter their circumstances, intentional or not, have access to the ability to put food on their table that they want to. And then we are a small team. We have a big goal, and we work to advocate and share the stories that are here and other places with policymakers in DC to make sure that they can, and we encourage them to test it and expand it and bring it to more people, these great stories that happen at the local level. So we are really excited about Food as Medicine for the same obvious reasons. It works, and it's a great thing to advocate for because it helps so many people. There's the folks in this room who, on the panel with me, who have received it as a patient. But we also get countless stories from all over the country from doctors who are thrilled to have access to the tool. Same with farmers and food retailers who have access to new customers and feel like they're better reaching the needs of their customers. So in that case of advocating for the program and expanding it so that is reachable to everybody, we really like to support efforts that help so many different people along the way. So that's our excitement about Food as Medicine. I imagine it's very similar for everyone else in the room.
Yeah. Can tell us a little bit about kind of some of the things Wholesome Wave is working on now, just briefly. Yeah.
Sure. Right now, specifically, we have produce prescription programs in the field that are investing deeply in questions related to fidelity, equity, and dignity for the communities that we're serving. Equity is health equity in particular has been indicated by the presidential administration here as being a top priority. You mentioned it in your opening remarks, Dari, that nutrition security is inherently an equity tool, a tool to advance health equity. So we have done a lot of patient-centered co-design through the process. We've engaged prospective patients who would be involved in the study design from the get-go, so they get to exercise their research chops in addition to hopefully receiving the prescription someday, and then being a part of the dissemination onward after that. So that's one particular program. We also facilitate the National Produce Prescription Collaborative, where we work with a lot of folks in this room to tell the story in DC about what's happening on the ground and look for opportunities to expand utilization and reach of the program.
Great, thank you, Brent. And we're proud at Tufts to be one of the founding members of the National Produce Prescription Collaborative that's led by Wholesome Wave. So thank you for all that work. Let's turn to Alice Mejia. She's from Mattapan, not too far from here, and found she was pregnant earlier this year, about 16 weeks. And as mentioned, her son, Janai, is here in the audience, now sleeping. So kind of remarkable that we're seeing the generational impact, positive impact of food as medicine. Alice, tell us a little bit about yourself, your story of your experience with this program, what it did or didn't do for you and your family.
I remember, like you said, I was like 4 months pregnant when I joined the program, and without hesitation, I said yes. Because usually before the program, I wasn't really the most healthiest eater. But I'm like, okay, let me incorporate now that I'm pregnant, see how my energy levels is at, and it impacted me and my family a lot. Like, I was getting, well, sorry. Aside from it being free, like the delivery portion was like amazing. I didn't have to go anywhere. The kids were excited, like, oh, a box is downstairs. They'll go get it for me. And I'm trying to figure out, like, oh, I never had this before. I never had, trying new things. And I want to give a shout out to my fiance because he would prep all the meals for me. I didn't know what to do. And sometimes with
Jalal, Francine Jalal is here, yes.
And at times, sometimes the delivery box would come with like suggestions on what to do with what came in the box. So, for example, there was like type of shake or smoothie or type of meal, and I was like, I tried it a couple times, and I did like it, and it did make me feel good.
And can you talk a little bit about kind of you have other children, right?
Yeah, I do have other children.
And so can you talk a little bit about the impact on them, and did they
I
try
was
new
able
things?
to.
And
Yeah,
how did it change their experience with food and groceries?
I always had to mix it with something, so they never knew like, oh, this is in it. But they was like, oh, this is so good. Like, yeah, what is it? And I was just like, it's a secret recipe. There was a little bit sad or upset that right before the baby came, there was no more surprises that they would call. Is there no box? Like, but I'm like, it's okay. But
so the program ended as your pregnancy ended.
As my pregnancy ended,
and what has that felt like?
I mean, pretty different now because it's not as fresh as the local supermarkets. But I do over time hope that there's more resources and things like that, so other people can actually kind of be involved in getting actually good produce products.
Yeah, and can you describe some of the contents of the boxes? What were some of your favorite boxes?
That was fun. That's a good one because I like the line mushrooms, which I never got to try up until the box. Arugulas, I love those. Those are like pretty much my favorites.
Wonderful. Well, thank you for coming and sharing your story and sharing your son with us today, which is amazing, and your fiance. And we'll come back to you. I think we'll have time to ask, sort of what would you like to see for others if this could become, a different program. So Julian, last and certainly not least, I've had the pleasure to get to know you. We've been on some panels. You visited the school in your work with Chris Economos. Tell us a little bit about yourself and maybe this project and why how you're in the area of food as medicine. Yeah.
Certainly. And thank you, Alexia, for being here. I'm so grateful for this partnership with Tufts and Chris. You're amazing. So, I am a fifth generation Mississippi Deltan, and you all saw the map about probably the most food insecure, and probably has indicators at the level of third world countries for disease, infant mortality, you name it, and certainly for diet-related illnesses. And so, I mean, it's something that's real. So, like on a personal note, like literally within a span of 15 years, from 2008 to 2023, I buried my grandmother and all of her children, including my mother, in that span. And she had 6 children, including my mother. Every single one of them had either cancer, high blood pressure, diabetes, heart disease, or some permutation of which, and all passed because of it. So it's real. It's almost normalized in being from that area. You will have someone that will die or suffer because of a diet-related illness, so chronic illnesses. It's just it's completely normalized. And so when I began doing anti-poverty work after college, between college and law school.
Which is here in Boston, right?
Yes.
You was at Harvard for your training and
Yes.
went
And
back to
so,
Mississippi.
yeah. So when I came back, obviously, when we were thinking about doing, anti-poverty organizing and work we do, obviously, food system, food justice work, and intersection with public health was number one. That was not, it wasn't a calling or something like, oh, I didn't have options. That's literally what I knew to do, because at the time of the Delta, there was an emerging food system, a movement that has a history with Tufts and Delta Health Center. It began with the food as medicine there, and prescribing patients to go to the 427-acre farm there. And so fast forward, there had been a movement around building locally grown food systems, because we're mostly dominated by corporate agriculture in the Delta. In Delta, even though we have the second most fertile soil in the world, only next to the Nile. And so the work I involved in for 16 years was building community food systems, building capacity for local food systems, and then marrying that to being able to address both food insecurity and public health disparities by trying to normalize that system so people had access to locally grown fresh produce. And so I was fortunate to do this work over 16 years, build capacity with the founding of an organization called Delta Fresh Foods Initiative, to do the work in the Delta. And then when I joined the faculty at Tougaloo College, we started the Anderson Center, building the only student worker-owned farm and food system on HBCU campus in the country. And so we kind of built the capacity, and then we made food as medicine a priority. And then one fortunate phone call to an amazing dean, at the time, before she was dean, about doing a food as medicine grant in 26 days. And our partner who was going to do it with us, the grant with us from PHA, dropped out, said, I can't do it. And so she and I had this awkward look like, we can give this a shot. 26 days later in March, literally the rest was history. And so we were able to launch what is one of the largest food as medicine studies in the country, that allows for randomized control, and it allows for both looking at trying to get allow for the proliferation of locally grown produce to address chronic illness, at the same time leveraging it to try to still build the food system in the Mississippi Delta, which is still not at a level that's sustainable enough to be able to have a greater proliferation of locally grown fresh produce to address food insecurity and chronic health. So I'm so excited to be on this journey, which began, almost 60 years ago with the founding of Delta Health Center in Tufts, to be here again, and now trying to do this in a very sustainable way.
Yeah, amazing. And for folks that don't know the story, the launch of the community healthcare centers was by Dr. Jack Geiger, who was a Tufts medicine physician, first in Roxbury or Dorchester. I can't remember now. I think it was in Dorchester. I think first in Dorchester, Massachusetts, and then very soon after, the first rural community healthcare center in the Mississippi Delta, which is the same community healthcare center that now Chris and Julian are partnering with to help Black farmers grow specialty crops and get those specialty crops to patients with diabetes or prediabetes and improve their health. So to create kind of this cycle. And when Dr. Geiger created that healthcare center in Mississippi, it was in 67, 66, I think, and he did not have a supportive Republican governor, or maybe a Democratic governor, I don't know. He did not have a supportive governor to try to improve the health of low-income minority folks. And so they were always looking over his shoulder and trying to figure out what he was doing with the grants and funding that he had from the state and the federal government. And they heard that Dr. Geiger was doing a food as medicine program. He was writing literal paper prescriptions for food that the patients would go take to their local grocery store. The grocery store would send the bill to Dr. Geiger, and he would pay for it from his pharmacy fund. And so the governor sent down an inspector, and he came in screaming and yelling, literally screaming and yelling at Dr. Geiger, saying, "You can't do this. You're breaking the law. This is not right. You're misappropriating funds, and we're going to shut you down." And Dr. Geiger looked at him and said, well, the last time I looked in my medical textbooks, the specific treatment for malnutrition was food. shut him up, and he went back to the governor's office and left him alone. So really, that was the first kind of modern food as medicine program in the United States, and so it's exciting to have this connection back, back again in your own commitment. And so I want to turn back to each of the panelists again, and we'll start back over here with Ruth. What would you like to see? What would be 5 years from now? What would make you happy? What would you like to see the healthcare system, do around food or some of these programs for patients like yourselves or others?
Well, I would like the healthcare.
Hold this up, yeah.
I would like the healthcare system to give allowance to people so that they would be able to get the produce that is needed to help them to, for the food that is very essential to them for the diseases that they have.
Yeah. When did your program end?
My program ended about, I would say about 2 or 3 weeks ago.
Just 2 or 3 weeks ago.
Yes.
And how has things been without the program compared to with the program?
Well, without the program, I am now in the kitchen cooking. Which is taking time away, and also going to the store, trying to pay those high prices for the food I have to do now, and gas for the car to get to. I mean, everything is so expensive. And I think, and I'm not, don't receive that much, money each month. And although I do receive enough, and I live with my daughter, that I am able to, buy food and stuff. But a lot of people are not able to. And I think that at least for those people, and even for people with, like low income, the government should help. Healthcare, insurances should, give allowance to people, for the food and stuff that they need.
Yeah, we talked about it earlier today when we met and we're speaking that your household income level is pretty low, but not low enough to qualify for SNAP, and so you're having trouble and struggling financially, but there's nowhere to turn for help. And it sounds like that program, at least for the 6 months that you were on it, was very helpful. And glad we were able to work with you on that. And I hope. Again, one of the goals of the Food as Medicine Institute, that we really show that the value and benefits of these things is worth normalizing. So this isn't something that's turned on and off. People have asked me, well, how long are we going to do some of these programs for some people? And I said, well, when I prescribe a cholesterol-lowering drug or a blood pressure-lowering drug or a diabetes drug, nobody asks me, well, how long are you going to give it to they get it as long as they need it. Some people might need it for 3 months. Some people might need it for 6 months. Some people might need it their whole life. And that's okay. That's what we do with healthcare. We decide who needs what program for how long. So I hope we're going to get on the path and on the journey where what you're thinking about becomes more real.
Well, also I think
please.
that they should help with counseling. Dietitians, people to explain foods and the different kind of foods that they should be eating and what they should be eating.
Yeah.
And they need help, with people doing that. Of course, most people are not informed.
Yeah. Has it changed your own thinking about what you eat now?
Really, a whole lot. What I eat and how much I eat, and it has really changed it. I know that how important it is.
Yeah.
To fight the diseases.
Yeah.
Food is to fight them.
Yeah. Thank you, Julian. Where would you like to see 5 years from now in this field of food as medicine? Where would you like to see the world? Yeah. Or the country and the world.
Oh, you're ambitious, Dari. And so, for me, I think, and I can sort of certainly speak to the perspective of the work we're doing in Mississippi. Definitely that there is in more states, and God, you knock on wood, Mississippi too. We'll see. We're always last for everything, but that there are Medicaid 115B waivers that are passed that allows for Medicaid dollars to be allowed to pay for prescription drugs, pay for food the same way it pays for prescription drugs. I think that will be transformative both for making the food system economically sustainable, while at the same time making sure that it has integration in the public health system. So we're, as part of our Food as Medicine project, for example, one of the things we did a formative evaluation before we were doing our distribution in a few months, and one of the things we made sure we talked to doctors and healthcare providers as part of that to get their input. as well as patients. And additionally, we're doing establishing local food policy councils. And we're doing that because we know, a part of the work will be sort of normalizing eating fresh food as part of your diet, making it part of making it part of your lifestyle. We know that's going to be key in making that so people normalize that, so doctors can begin to think, okay, we need to make sure we incorporate diet as part of treatment, and therefore now we would have Medicaid making sure for those patients to pay for it. Then we address food insecurity, and we are able to provide them this medical service, and then of course we're making the food system sustainable. So that would go a long way into really advancing food as medicine before you even get to the federal level.
Yeah, absolutely. All the states can innovate. Yeah. Alice, what would you, just briefly in a few words, what would you like to see in, a year or two or more, happen in healthcare around food?
That is more, for it to be more accessible, especially for those who is not available to get it, but be able to, to incorporate healthy lifestyle.
Yeah, until you were in this program, did you get a lot of counseling or input on healthy lifestyle in your healthcare with doctors to the visit, or was this kind of the more meaningful?
More meaningful.
Yeah.
We'll do a survey and ask how it's going, and if I'm benefiting from it, if it's enough, if it's not enough. To me, it was enough. And like I said, now I'm getting stuff from the local markets, and it's not lasting me as long as my delivery would, when I would receive it. When I would receive it, I feel like, it stay fresh for a while.
Yeah.
It don't go bad, and it actually really tastes good.
The delivery is pretty substantial, because delivery can really change access for
having kids is hard to just go to the supermarket. They want everything.
Brent, what would you like to see where the world going? Yeah.
I've got three, but they will be quick. One, I think Mississippi Medicaid should be able to cover produce prescriptions and other food as medicine without having to go through a waiver process. It should be standard part of all Medicaid. And that's maybe the 5-year goal, maybe even a little bit before that. This one's more practical. We're in baseball season now. I would like to watch a World Series in a couple of years and see a call your doctor and ask your doctor about a produce prescription commercial. I think that would be the indicator that we're all succeeding in this work, I think, really well. And the private sector is on board too. But this is where the Food as Medicine Institute, I think, will come in most importantly. And I think this is the most impactful one. And I'm going to call it FIMI. And we'll see if that sticks. That's unauthorized, but we'll go with FIMI for a while. I think we need MedPAC and MacPAC, and this is for some policymakers in the room, MedPAC and MacPAC to make a coverage determination on food as medicine, on all the types of food as medicine in the pyramid that exists. And to get there, these interventions have to go through an FDA level clinical trial. And I think that's where you guys will come in, certainly as we go along. And that coverage determination, even if it isn't 100% coverage, it will push a lot of doors open for us as we go along. So those are my hopes.
Wonderful. Well, we have one randomized controlled trial we've just completed with Kaiser Permanente and FoodSmart in patients who are on Medicaid with type 2 diabetes in Southern California. We're going to be reporting that in a few weeks at the American Heart Association, so the first and largest randomized trial in diabetes. Kaiser is launching another randomized trial now, we're participating in with Instacart, 1,100 patients with diabetes all throughout California, which I think will be, again, a seminal trial. And then we're hoping to launch a similar sized definitive randomized trial in high-risk pregnancy in Georgia, where Kaiser has a big footprint, either with funding from Kaiser, or we've also thinking about some federal sources. So I think that would be 3 definitive trials, and that could be enough, right, to then submit a coverage determination. So it's not that far away that this could be real for millions of Americans. So I really want to just say thank you to the panel mostly for what you're doing every day when you're not here, all the work that you're doing, for you, Ruth, taking care of yourself and your daughter, for you, Alice, taking care of yourself and your family and the work you do in your community, and Brent and Julian for the incredible work that you do as well. You can just see the cross-section of people for whom food as medicine is important and interesting and powerful and meaningful. And this is a cross-section of America, right? And this is really important for, I think, every state. And I'll just close and say, you talked about international. We are doing food as medicine trials in Australia right now. We just had a call with a foundation in Canada who's interested in potentially doing this. Someone from the Treasury at the UK called me and said they're interested about food as medicine. But one of the most interesting conversations I had just a couple weeks ago, I met a minister of health for a large, low-income nation, and she had no idea what I did. We just met at a reception, and she's a very successful minister of health for her country. And I said, what's your top priority for the coming, couple of years now? And now that COVID is sort of, quieting down, and she said nutrition. And that was kind of music to my ears. And I said, great, what conditions are you thinking about? Thinking she was going to say vitamin A deficiency in kids or stunting or wasting. She said stroke and cancer. It's devastating our country. And so we talked about food as medicine, and she's very interested and has introduced me to her staff now to talk about maybe a possible food as medicine trial in her country. So there's real interest, and I hope, although our focus will be in the US, that this can also extend to other nations. So thank you so much. Thank you to everybody. Please give everyone a round of applause. Thank you. Thank you. Thank you. Thanks, Brent. Careful, there's waters here. Thanks. Yes, Brent. Yeah, thanks, Joy. Thank you. Was I over or under? I couldn't tell. Was I over or under? I couldn't tell.
Hello, everyone. My name is Sydney Grob, and I'm an MD PhD candidate here at Tufts. I first became interested in food as medicine research when I spent an academic semester volunteering at Grow House in Globesville, Colorado. It's a nonprofit organization with the mission of cultivating food justice at the community level through facilitating food access. And through that experience, I saw how increasing food and nutrition security could improve the lives of individuals living with chronic non-communicable diseases, and that informed my future career goals as an aspiring pediatrician and food as medicine researcher. Today, my PhD dissertation focuses on plant-based diets in youth, and the third aim of my PhD dissertation would not be possible without the new Food as Medicine Institute, which will focus on developing and validating a nutrition and food security screening tool into the electronic health record of patients treated at Tufts Medical Center. I would now like to introduce our next two videos, remarks by Congressman Jim McGovern and United States Senator Ed Markey. Congressman Jim McGovern serves as top Democrat on the House Rules Committee and a senior member of the House Agriculture Committee. He was first elected to Congress in 1996, and he represents Massachusetts' 2nd Congressional District, which includes his hometown of Worcester as well as much of central and western Massachusetts. On the House Agriculture Committee, McGovern is a strong supporter of nutrition assistance programs like SNAP. For more than 40 years, Senator Markey has served the Commonwealth of Massachusetts as a congressman and U.S. senator. On a bipartisan basis, he has passed more than 500 pieces of legislation into law. As the chair of the Primary Health and Retirement Security Subcommittee on the Health, Education, Labor, and Pensions Committee, Senator Markey believes that creating a high-quality, holistic healthcare system means recognizing healthcare as a human right and addressing social determinants of health, including access to affordable, healthy food. In addition to fighting to expand access to healthcare, Senator Markey has also fought to protect and expand access to SNAP. Now let's turn our attention to their remarks.
Hi, everyone. It's a pleasure to have the opportunity to speak with all of you, and I'm just sorry I couldn't be there in person for this huge, exciting announcement, the new Food as Medicine Institute. I want to congratulate Tufts University, the Friedman School, and all the staff, students, and researchers who worked so hard to make this day possible. When it comes to food as medicine, Tufts University is already a national leader. But this institute takes things to the next level. This is a huge boost to the food as medicine movement globally. And I'm so excited to partner with your team to bring groundbreaking transformation to our food and healthcare systems. I want to congratulate my friend, Dr. Dari Musafarian, who has, as you all know, been one of the staunchest leaders in this work. And I'm confident he is the right person to deliver real results here, and I know he is ready to hit the ground running to make a difference. Look, since my first day in Washington, I believe that access to good food shouldn't be a luxury. It should be a fundamental human right. that no one should have to worry about where their next meal will come from, that our country and our world is best served by fresh, nutritious, local food that helps people live longer, healthier, better lives. This institute furthers that mission while being rooted in the science we already know. Eating a balanced diet improves your health and saves healthcare costs. So here's the bottom line. Right now, we live in a world where providers are writing more and more prescriptions, while researchers are telling us that a lot of the time, prescribing fresh fruits or vegetables might also be able to help. We need a paradigm change. And that's why this new institute is so important, so vital, and so necessary to help address these challenges and drive the change needed to fix our broken system. I want this institute to change the world one healthy meal at a time. And I'm ready to be wind at your back in whatever way I can to make that happen. So thank you again for the opportunity to be part of this special announcement. I'm so excited to see the impact this institute will make. And I'm so proud that this groundbreaking center of research, health equity, and transformational change will be right here in Massachusetts. Thank you.
Hello, Tufts Friedman School. I am Senator Ed Markey, and I am so excited to address your community as you launch the Tufts Food is Medicine Institute. Tufts has always been a special place for me. As a young congressman, I used to work with President of Tufts, Jean Mayer, on the issue of food, of nutrition, of health. And I just want to today thank you at the Friedman School, because we now know more than we have ever known about the tremendous power that food has to improve health, outcomes, and quality of life. But we also know that we have work to do to turn that knowledge into change. For too many people, groceries are just too far away, and healthy food is just too expensive. The consequences are felt most by Black and brown and low-income families in Massachusetts and across the United States. And when people can't afford to fill their pantry with healthy food, they struggle at work and at school. Over the long term, a lack of healthy food puts people at greater risk for preventative illness. The solution is clear. We need to make sure every community can afford healthy food. That is why I am fighting to increase access to SNAP benefits, fend off cuts to programs that increase access to healthy foods and vegetables, and make sure community health centers and other health providers have the resources and tools to include nutrition services in their care. And I'm so proud that the Friedman School right here in Massachusetts is a partner in this fight. You are collecting data on hunger around the world, standardizing healthy food assessments and expanding access to foods, vegetables, and healthy foods in general. Now, with the establishment of the Food is Medicine Institute, you are ensuring that we build the bridge between health and nutrition. Because when we talk about holistic healthcare, that includes access to nutritious foods. I just thank all of you for what you are doing. You're helping the people in Massachusetts, around the country, and around the world. From Jean Mayer to today, Tufts has been the international leader. Thank you for what you are doing. Go Jumbos.
Good afternoon, everybody. Welcome again. My name is Ronit Rydberg. I'm a research assistant professor here at the Friedman School, and now I can say at the Tufts Food is Medicine Institute, where increasingly my research focuses on food as medicine as a way to support maternal and child health equity. Alice, thank you for bringing your baby here today, and I think it makes all of us happy. I'm really interested also in understanding how people use produce prescription programs in particular and how they want to use them. How much money do they need? How frequently do they want to shop? And we want to test strategies on how to increase participation, engagement, and benefits utilization. really the way that people want to be using these programs. Separately, I'm working with colleagues, as has been mentioned, at Tufts Medicine and across the street at Tufts Medical Center, and as Sydney mentioned, to integrate not just food security, but also nutrition security screening tools into the electronic medical record and create clinical care pathways and referral systems to streamline food as medicine programs really into the integration of healthcare delivery. So it's super exciting to have all of you here today in person and online, and I will be presenting the next panel. Introducing the panel Cross-Sector Initiatives for Advancing Food as Medicine. I'm going to ask our panelists and moderator to please come up to the seats while I introduce you. This panel will feature leaders who are working across sectors in food and health and talk about how innovative partnerships can advance food as medicine initiatives. So our first panelist is Mike Dandorf, President and CEO of Tufts Medicine, a leading integrated health system bringing academic and community health care to consumers across Massachusetts. His career spans 3 decades of service to academic health systems. He's highly regarded for executing broad transformational change that incorporates innovative partnerships, high-performance teams, and a relentless focus on consumer-centric patient care. Dr. Neera Gorin is the head of health information quality at Google, where she leads a team of clinicians focused on tackling health misinformation and ensuring the quality of health information across Google's platforms like search and YouTube. Neera is also leading Google's new Food as Medicine initiative, which aims to facilitate the development of products and programs that will improve nutrition information quality and further access to high-quality food through collaboration with key partners in the food as medicine space. A pediatrician by background, Neera was previously at Google DeepMind and the Boston Consulting Group. Pam Schwartz is Executive Director of Community Health for Kaiser Permanente. She leads the organization's national food security strategy and other social health priorities, including ensuring that social health interventions are integrated seamlessly into care and services provided to Medicaid members and across all lines of business. Under her leadership, Kaiser Permanente has designed, tested, and scaled numerous outreach campaigns to enroll members in public benefit programs. Pam also oversees Kaiser Permanente's $50 million Food as Medicine commitment made alongside its role in the White House Conference on Hunger, Nutrition, and Health. An early advocate in the food as medicine movement, Pam has helped establish the evidence base and business case for addressing food and nutrition insecurity at Kaiser Permanente and in healthcare systems across America. Brooks Tingle is President and CEO of John Hancock, the U.S. segment of Toronto-based Manulife. Based here in Boston, Mr. Tingle leads John Hancock, one of the largest life insurers in the United States, in supporting more than 10 million Americans with a broad range of financial products, including life insurance and annuities. Prior to becoming president and CEO, Mr. Tingle led John Hancock to embrace and implement the company's now market-leading behavioral insurance solution, John Hancock Vitality, which offers life insurance customers significant savings and rewards for taking everyday steps toward a longer, healthier, better life. Dan Glickman, former U.S. Secretary of Agriculture and chair of APCO Worldwide's International Advisory Council, is the former executive director of the Aspen Institute Congressional Program, a non-governmental, nonpartisan educational program for members of the United States Congress. Secretary Glickman served as a member of Congress from Kansas from 1977 to 1995. Secretary Glickman also serves as a senior fellow at the Bipartisan Policy Center in Washington, D.C., formed by former Senate Majority Leaders Howard Baker, Tom Daschle, Bob Dole, and George Mitchell, to develop and promote bipartisan solutions to the country's problems and to promote civility in government. Please join me in welcoming our panelists, and I'll now hand it over to our session moderator, Secretary Dan Glickman.
Okay, thank you all. The introduction was great until you got to civility in government. I think what a hell of a job I've done in that area, right?
Keep trying.
Yeah, keep trying. Anyway, it's such a delight to be here, to be with Chris and Dari and the whole team in this exciting creation of an institute which can have a transformational impact on our healthcare system and the ability of people to live longer and healthier, which is our goal. And yes, this is a kind of a complicated issue. I'm glad we started with some of the patients, the people who've received the benefits, because we've seen how it impacted their lives. Now we're going to see how the institutions of America, so to speak, health and others, can interrelate to all these and how it interrelates into their lives. This is not an uncomplicated issue because you're talking about all sorts of issues. The role of providers. Do they know anything about the subject we're talking about? And are they willing to intervene in those decisions? Marketing and advertising of foods, education, science, federal and state programs, schools. I mean, it just goes on and on forever. And my interest, of course, is in policy. So how all of what we're talking about is going to help policymakers, not only in Washington, but the state and local level, as well as the private sector and the nonprofit world, cope with these things. So it's really important what we're talking about here. So Michael, I want to start with you. I was going to say you run the medical programs at Tufts. I don't know if you think you run them all, but you're at least at the top of the food chain, so to speak, of all of this. So I'm just curious, why did Tufts decide to go down this road of creating a food institute? And where do you see this thing going in terms of your infrastructure and healthcare at this institution?
Well, thank you. And run would definitely be an overstatement.
Yeah.
So, but really what I'm trying to do is set the stage to set a different trajectory for healthcare. And at Tufts Medicine, what we're really trying to do is be a protagonist in what we need the healthcare industry to look like. You introduced me as the medical enterprise, and I think we provide great medical care in the United States. But we really do fall short when it comes to healthcare. When you think of health outcomes, the costs of healthcare, the experience of healthcare being very fragmented, and we've siloed the way that healthcare is organized in a lot of ways. Again, do we provide and do great things for patients? From a medical lens, absolutely. And we do that here and across the street and in other parts of our network. The interest around food as medicine, particularly for me and for our health system, is our commitment to population health and really thinking about the experience of healthcare from a population science and a population health perspective. How do we address the costs of healthcare so that we can create more affordable, accessible services? How do we improve the health of populations in a way and start to think about food as an element of that? And how do we embed this into our care processes? Because it can't be a standalone initiative that sits on the side. It really needs to be integrated in our processes of care. Otherwise, it's just going to become more burdensome and one more thing for our physicians, our nurses, our care managers to do. So we're really working closely with Diary and his team and a number of other partners on how do we integrate the work of getting healthy foods and targeted foods from a prescription perspective into the care process. And we believe that will not only improve the populations that we serve, that it'll also address health equity issues, which is also something that we're very committed to given the diverse populations that we serve in Eastern Massachusetts. So these are all really important things that we need to embed operationally into the work.
And would your goal long-term scaling this up so it's just an integral part of your entire healthcare practice, teaching, providing counseling, just the whole impact that will have on consumers as a whole in this country, whatever the income level they're in? Do you believe that this can be scaled up into something that's very comprehensive?
Absolutely, and there's several pilots that we're initiating again with Diary and others' help to really think about how do we measure the work that we're doing. We're an academic health system, so research is incredibly important to us. We think about how do we become more of a learning health system. We're very close partners with the university in a number of aspects. Food is medicine, and this institute is an important one. Our Clinical and Translational Science Institute is another. And what I mean by a learning health system, when we really think about how do we embed this work in clinical practice, is how does research influence practice and how does practice influence research? And it's got to be that closed loop process. So we need to be as committed as providers to participate in that research and that ongoing learning so that we can scale what works and frankly stop what doesn't work. And that's part of our challenge, right, is we continue to add more and more things to our providers' plates, but we're going to need to be able to take things that don't work and sunset those so that we can focus our resources and energies to the things that do work. And the promise of food in that is incredibly important, and the potential is just dramatic. I get excited every time I sit with Daria. I remember the first time we met, we were sitting at a Starbucks. He got a green tea and I got a macchiato. I felt bad ever since.
Well, you know, the old expression is when you look in the dictionary into the word enthusiasm, his picture is there, you know. So Brooks, okay, so your role. I've been on a panel with you, I think, here before. I know you've been a big supporter of Dari and all the work that Tufts has done in this area. But the insurance industry is actually pretty key in determining whether there's an infrastructure to actually get this done. I mean, you have the federal insurance part, which is Medicare and Medicaid and related programs, but 80% of the people are not in those programs. They're in the private healthcare system. How do you think that you interface with what we're talking about today with the work of companies like John Hancock and others?
Yeah, well, we do. First of all, I love Dari. Hanging out with him is a real challenge if your diet's not up to snuff. I had
eat before you meet with them. That's the idea.
I had really a real pleasure of taking Dari and his family to a football game recently, and tailgating with Dari is not something you want to do. I think he would describe my tailgate as food is poison tailgate. But anyway, so yeah, well, we play. So John Hancock, 161-year-old company, headquartered just down the street. Really honored to be here. And we offer a diversified range of financial solutions, but the offering that we have that we think is just hugely relevant to what Tufts is doing is our life insurance offering. Anybody here own life insurance? Yeah. Well, let me tell you a little secret for those of you that own life insurance. Beyond your immediate friends and family, there's no one that wants you to live a long, healthy life more than me and my colleagues in the life insurance industry. I tell you how the business works. You pay us a premium, we invest those premiums. Someday you die, we pay your beneficiaries money. The longer we can invest those premiums, the more money we make. So given that fundamental reality, just being honest, so given that self-interest and that fundamental reality, it struck us as profoundly odd for the hundreds of years of history of the life insurance industry, we would issue policies on people, sit back and say, I sure hope they live a long, healthy life because that'd be good for us, but do absolutely nothing to try to affect that outcome. So 8 years ago, we launched a program referenced in my intro called the Vitality Program. It's an app. And think of it almost as like, really simply, as like a frequent flyer program. With airlines, the more you fly, the higher the status level you get, and you get different perks. You can board the plane early, get a nicer seat, what have you. I'm not sure there are many nice seats left, but it's the same concept except around wellness and life insurance. Everything you do that correlates with living a longer, healthier, better life, we're going to give you points for. Those points accumulate and you get a status. And that status level determines how much of a discount you get on your life insurance, but then the value of a range of other rewards, a free Amazon Prime subscription, travel rewards, you can earn a free Apple Watch, too much stuff to talk about. So when we launched it 8 years ago, there was a heavy emphasis on physical activity. Wearables were just becoming sort of the rage, so we gave everybody a Fitbit at the time and gave people points for physical activity, which we still do. And then the other point of heavy emphasis was points for preventative screenings, mammograms, colonoscopies, good biometrics, things like that. Well, we realized literally 1 year into the program, which some of us have realized the hard way, that you can't exercise your way to good health at some point. Nutrition is huge, and I guess you could debate, which is I would argue, having hit 50, that nutrition is a bigger factor than exercise. Actually, you need to do both. But we had a real hole in our program as it related to nutrition. So we partnered with Tufts at that time and have had a wonderful collaboration with Dari ever since in providing our customers with the education, the tools, and really importantly, and you talk about the role our industry can play, the incentives and the rewards to make good choices. Our program offers discounts on healthy foods. If you're one of our policyholders, you can get a 25% discount on fresh fruits and vegetables at over 17,000 grocery stores nationwide. You go to the checkout, right on your receipt, $5 bag of apples minus $1.25 John Hancock Vitality. And
Who paid? Did John Hancock pay for that?
we do, yeah. And the impact that we can have is proving, and Daria and I go to DC not infrequently and talk about the value of incentives and rewards. If you provide a discount on something, people will oddly use it, right? If you reward somebody for it, we also give points in our program for buying, healthy foods. People want to earn points because they want to get free stuff. So there are lots of ways we can play. I think fundamentally, first and foremost, we're proud to represent a whole industry that just hasn't been at the table for these discussions. And then I think we can share a lot of insights about the value of incentives and rewards.
That's great, and it's what you're doing is terrific. I know you're not necessarily heavily in the health insurance side of the picture, but they're a very key player in a lot of these subjects. I mean, what they reimburse people for, we heard before about Medicare or Medicaid not reimbursing. And so the health insurance industry is also a key part of this. Do you work with them at all in any of these issues?
Well, we sit on a lot of panels together. Yes, in different ways, particularly around certain innovations around early cancer screening and things like that. So we do. We need life insurers, frankly, I would argue, have the most skin in the game, because if you're a health insurer or you're an employer, like there are employer wellness programs, but the average employee stays at an employer now, I don't know, 4.8 years or something. The average length of relationship that we have with our customers is 24 years. We paid a claim recently where the client had been a client for 99 years. Parents bought the kid a policy on his first birthday, died shortly after his 100th. So we have literally lifelong relationships with our customers. So we can monetize better long-term health outcomes, frankly, in a way, I think even more so than health insurers, who have a little bit more, I'll let you speak to it, but I think a little bit more of a short-term dynamic.
Well, we'll get to Pam in a minute. I think you both are important, because if reimbursement's not available for a lot of things that can deal with prevention, then it's going to impact your ability to keep those people alive for a long period of time.
Correct.
So let me go to one of probably the most impactful and transformational companies now in America, and that's Google. And I've been out to Google, and I had lunch there a few years back, and they have this incredible campus. I don't know, how many of you have been to the Google campus? Okay, quite a few here. And they were ahead of the game in terms of their meals and in terms of employee relationships. But it's interesting to see, Neera, your position at Google. And I wondered what you might talk about why you do what you do at this company, which every one of us is involved with from morning till night. I mean, I do a search 55 times a day. And we're all in this world. And with AI coming up, and really the AI is a kind of a follow-up to the Google search. It's just a more sophisticated way of doing it all. So talk a little bit about why Google is in this game.
Can you start by telling us what Dan searches?
Well, not today, certainly.
Unfortunately, I can't do that, but I'm not sure if this is on.
It's on.
Yeah, okay. So thanks. Yeah, great to be here. And like was said in the intro, my name is Neera Gorin, and I lead our health information quality efforts at Google Health, and also our new Food as Medicine initiative that we are just launching today. So I'm really excited to be here and be part of this really important community. When we say health information quality, what we're referring to is the information that people find when they come to Google's platforms like search and YouTube with a health question. Google gets hundreds of millions of health-related questions every single day from people around the world, probably maybe from Dan, we're not sure. And we need to make sure.
As a matter of fact, I just want to tell you this morning, I searched about the role of magnesium in our diet. And, and I got about 1,700 different answers as I looked at that search.
Hitting the nail on the head. And the question is, how do we ensure that the information people are getting back is high quality? When we say high quality, we mean how do we ensure that it's evidence-based, that it's accessible? So that's what my team works on. And when I started working on health information quality 4 years ago, I was pregnant with my son. And it was my first pregnancy, and I wanted to do everything right, like all mothers do. And I knew that it was important to nourish myself with healthy foods. And you would think that as a pediatrician, I would have been armed with all of the nutritional knowledge on how to do that. But like I think Dan said, and maybe Dari said at one point, I quickly realized that I actually knew very little about nutrition because, like most physicians in the US, I had received very little nutrition training, which is a problem that I know the Institute is going to be working to solve. So I started reading a lot, and I started devouring the nutrition literature, information from credible sources online. And frankly, the only thing that became clear was that deciphering fact from fiction in the nutrition information space is no easy feat. And that's really when, I guess, all of my world as a mom, my world as a pediatrician, and my world as head of health information quality for Google collided. And I just thought to myself, it just shouldn't be this hard to know what to eat to be healthy. Google's mission is to organize the world's information and make it universally accessible and useful. And that includes nutrition information. We know that nutrition is critical to health. And if we can empower people, organizations to make optimal food choices, then we can make billions of people around the world healthier. And so that is why we're really excited about this space. We recognize food as medicine as critical to this mission, and we're excited to be part of this community and try to accelerate this important field together.
So what would your, in terms of your, let's say, short and long-term goals in food and medicine be? To improve the quality of information in the search engine process? I mean, what are the kinds of things that you would do?
Yeah. So there are well-established social and structural determinants of health, as we all know, like housing and education. But the pandemic actually really highlighted an increasingly important determinant of health in the digital age, which is information. And when we think about information as a determinant of health, we recognize that Google, as a global information technology company, has the responsibility to consider how to continually improve our products so we can ensure that we are positively contributing to health outcomes. We know that 3/4 of people in the US turn to the internet first for health and wellness information. And that number is even higher in places like Indonesia, where 85% of the population is looking for health information online. And we know that people are asking a lot of nutrition questions. But like I said before, that what we would think of as the user experience is not great. It's very confusing. People find a lot of conflicting information, and sometimes there's misinformation, and it just makes it really hard for people to know how to make optimal food choices. And we want to make that easier. That's the main goal here, is to make it clearer and make it easier. And that's why we're really excited to be partnering with the Tufts Food as Medicine Institute, so that together we can explore how to utilize our technology to help provide higher quality information so that people and organizations can make optimal food choices. As part of this work, we will be exploring the role that artificial intelligence can play, including generative AI. And we're hopeful that this collaboration will help us progress the mission that we've been on to provide up-to-date, accurate, useful information so people can make those optimal food choices.
Sure that Tufts is really delighted to have this partnership with Google. I think it's really important. Glad you're here, both as a medical doctor as well as with the largest tech company in the world, probably, or one of them, certainly. So Pam, you're no stranger to this subject. And, you know, I deliberately ended with you because Kaiser is not only one of the largest providers of medical care in the United States, but it's a source of innovation in terms of providing of new and innovative and entrepreneurial options to deal with a lot of these issues. And you're at the forefront in a lot of the food as medicine. And I know you've got a lot of stuff going on and new programs. As I think Dari mentioned one of them. You might talk about what you're doing in this area, especially the new stuff.
Yeah, well, thanks, Dan. It's nice to be here again with you and again with, well, and I've also had the matcha macchiato experience, so warning to all. Well, we've been in this space for about 5 years now, and one of the very first phone calls I made when I was trying to decide what is the what's going on in the area of, at that time, food as medicine wasn't the buzzword that it is now. So the question I was asking is, what should we do? What should healthcare be doing in the space of food insecurity? And I picked up the phone and I called Dari. This is 5 years ago, and it was I remember it very well. It was a very quick conversation. He said, do these 5 things. The first one was screen for food insecurity, and he might have mentioned nutrition insecurity, although it was still in the early days of that thinking. He also said connect to local organizations like food banks, et cetera. And then he said medically tailored meals. But he said, don't just do the interventions of medically tailored meals, but help to build the evidence, because the nation needs to know what works and under what conditions. And so we launched 4 medically tailored meal studies. He also said, connect to government programs. And so we launched an interactive texting campaign. We now have 125,000 people that we've helped to apply for SNAP. We've also been working on WIC and getting members enrolled with WIC and staying enrolled with WIC. And so that's a newer intervention. And then last, he said produce prescriptions. And that at the time wasn't very, Brent talked about it today. It was in the early days, 5 years ago. So it wasn't really something we fully understood. But Dari mentioned that we now have 2 produce prescription studies in traffic. The first one has just wrapped. It was with Food Smart and Instacart. Dari mentioned that, but it was delivering a curated box of produce prescriptions to a Medicaid population of diabetic or pre-diabetic for 6 months. And we're just analyzing the data. They're presenting it very soon, and it's seeing lower rates of A1C in a really hard to serve high risk population. So it's a super exciting finding. Our clinicians are really excited about this. Our patients are really excited about this. And this also informed the second study that Dari mentioned, and that was our partnership with Instacart that was announced a couple of weeks ago. And this is where we wanted to take also a produce prescription study, but this time give the patient more choice. So Dari helped us to create a curated list of healthy items that then we could purchase through what is within the requirements of CalAIM, or the allowances of CalAIM. So it's $100 to Medicaid, Medi-Cal, in this case, members with diet-related disease, to use the Instacart platform to purchase those healthy items online, also layer their SNAP, have it delivered to their home, all of it, the SNAP, the curated list, and then whatever else they need, toilet paper, whatever else they're bringing home for their families. And then again, all delivered again for 6 months, looking at similar outcomes to the first studies. So looking at A1C, looking at utilization, quality of life, equity, behavior change. And so we're super excited to learn from that. We have another study that we've been planning for around the maternal and child health population in Georgia. This is also one of our harder to serve populations. We have a lot of health outcomes that are not going well in that population that we want to really explore. Is food as medicine an option there? And maybe I'll say one more thing, and then Dan, I'm sure you have questions, but just to say, we saw the data about diet-related disease, we saw the data about food insecurity, and we see the data in our own members. Dan mentioned that we're a large integrated health system, but we have 12.7 million members, and we know that they have a lot of food and nutrition insecurity. We know because we've asked them. We surveyed them recently. It was about maybe 4 months ago. And what we saw is that 25% of our members report poor food or nutrition security, and then or struggling, I guess I should say, are struggling with food or nutrition insecurity. And so that's 25%. If you look at the Medicaid population on Medicaid plans, then we see that number double. So it's 50% of Medicaid members. And so this is a lot of people, 12.7 million. You can do the math. It's a lot of people. And so we've been trying to look at interventions that can be scaled and that can be sustained into the fabric of healthcare. We have so much enthusiasm for this, but what's missing for us is understanding the evidence in ways so that you know which disease categories, which target populations, what's the duration, and all of that of the actual intervention that is the most impactful. And then we're also looking at what are the ways to scale it and sustain it and pay for it. So those are all the things that we're still challenged with today. And Tufts has been an incredible partner in helping us get into traffic and not only as thought partners, which I already mentioned, like telling us what to do, but also rolling up their sleeves from many of the people who presented even today. Ranit, Fang, all of you have been such incredible partners. Kurt, I saw you, I think, in the back, really helping us to build the evidence and think about how to scale this and operationalizing it into the fabric of healthcare.
Yeah, you actually answered my next question, which was on scaling this thing up. So we don't have very much time left, but I'd ask each one of you to start down at the end there in terms of making everything we're doing here and cooperating with Tufts in the process suitable so patients, consumers, after all, that's what we're geared for is health, and health relates to the individual health of individuals. How the best way we can do to as part of this food as medicine process so that we have an educated consumer. There used to be a store called Sims. Some of you may remember. They were a clothing store, and their slogan was, "An educated consumer is our best customer." And so I've thought, what do we do to help educate the public more in this area? Is there anything we can do as part of this institute to do that? You talked a little bit about that in terms of what Google's role is, because the millions of people who access the Google search engine all the time. But going down the list, what one or two things can we do to make it so that the average patient, the average citizen in America benefits from this?
Well, I think that the launch of this institute is critical to that endeavor. It certainly is for our mission at Google. And so I just want to thank Dari and the whole team because I think that the partnership that we can now have with what is truly the global center of excellence is what is going to allow us to figure out the best path forward to ensure that we are delivering the highest quality nutrition information to the consumer and provide that education so that when they are going to the grocery store, et cetera, they feel empowered and they feel like they know the choices that they want to make.
So information is the role of Google in this process.
Information is a determinant of health, and that is the role that Google can play.
Michael, what would you say the best thing to kind of, as we link all of this to actually improving better health, I mean, what's the best thing we can do to make the consumer and the patient healthier in this process?
I'd like to think that in the next few years, we actually start thinking of food as part of our continuum of care. It's not something nice to do. It's something that we actually need to do in terms of prescriptions. And as I think about that, there's a series of things that have to happen in order for that to occur. And I mentioned this before, but we need to embed screening and prescription into our electronic health records to make it easier for physicians to do that. And we're working closely with the Food as Medicine Institute now on how do we do that? What are the sorts of questions that we should ask from not only from a social determinants perspective, but specifically around nutrition. And we need to start to evolve the science. We've done amazing things in terms of targeted therapeutics. And we need to think about food as a targeted therapeutic. And that's what I mean by if we really could start to treat this as part of the continuum of care. And the more and more we can do that, I think we'll lower the cost of care, we'll improve outcomes, we'll improve the health of our populations, we'll really start to address some of these health equity issues. And there's plenty of money to put towards this. I mean, we spend $4.5 trillion on healthcare a year as a country. We just need a piece of that that's really going towards food as part of the Food as Medicine and improvement campaign.
Great. And Pam, one thought I had as you were talking is, how do we share these best practices that you're doing these studies that are out there? A lot of great stuff happening all over the country, and Tufts will be the center of that in terms of this issue. How do we get that out so that the medical community and the public know about it?
I mean, I'll say to your first point about Tufts, not only are they a great partner to all of us in the room, but they're really good at convening and communicating, writing, presenting, and so are all of us in the room. And so there's just a lot of all hands on deck that can help to spread this. But I wanted to actually touch on your earlier question, because I can think of, I think it was said by Secretary Vilsack, there is a role for healthcare in communicating this to patients in ways that I think we're not taking full advantage of. We can see the open rates of our texts and emails when we tell people about SNAP, for example. And so we're getting higher rates of interest than some of other people that are making similar messages. So taking advantage of that, also thinking carefully about what needs to happen inside the walls of medicine or in the clinical experience, like clinical appointment, versus what can happen in other ways, and really thinking about that very creatively and innovatively. I think that's another thing. And then last, lived experience, planning everything with lived experience. So that is that was said today, but I just can't emphasize that enough. When we design these programs, we try and design with lived experience, and also that goes into how do we talk about it. So bringing that into the how we talk about it.
Brooks, we'll close with you. You have any thoughts about this particular area, about how best to not only get information to the patients, scaling it up, how to get patients and consumers engaged in all of this as well?
Sure, two quick thoughts. One, I think we really need to think about behavioral science. I mean, the education is awesome. I'm so excited about the work you're doing. But there are elements of behavior and behavior change here that it's not just, trust me, when I was driving back from the airport from a trip last night about 8:30 and I picked up delicious pizza, I knew that pizza, intellectually, I knew it wasn't my best choice at that time of night. So you,
Was Dari with you? When you did this?
I assure you, I would not. I would have been forced off the road in a different direction. But education alone isn't it. There's complicated psychology that goes on around nutrition in particular, and how do we address that sort of behavioral change and sustained change. The second thing I would say, at least for those of us in industry, it's not enough just to serve our direct customers in these ways. I'm very proud of what we're doing to help our customers live longer, healthier, better lives, eat better, and so forth. But the reality is a whole bunch of Americans, if you have a life insurance policy with John Hancock, you probably absolutely don't need that discount. It's helpful and it affects behavior change. There's a whole segment of society that just doesn't have access to our products. And a quick story, here in Boston, there's a neighborhood called Back Bay where our home office is. Life expectancy, if you live in the Back Bay, is 92 years. 2 miles away, as a crow flies, is a community called Roxbury. And life expectancy there is 69 years, 23-year difference 2 miles away. So I would say those of us in industry have an obligation to not just serve our customers well, but whole communities. And I mentioned that discount program for buying healthy foods. Last year we matched every dollar that our customers saved with a donation to Wholesome Wave, actually last year. Right now, we're matching every dollar that our customers save with a donation to the new institute and to World Central Kitchen. So industry can play a direct role with their policies and helping public policy, but we also have to make sure we're serving everybody.
Well, this has been a great panel. Thank them all for their great work.
Thanks, everyone. I'm here to introduce a couple of our last speakers today. My name is Julia Sharab. I'm the Senior Research Coordinator and Manager of Communications at the Food is Medicine Institute, and I'm also an alum of the Master of Nutrition Science and Policy program here at Friedman. There are a lot of exciting projects underway at the Institute, with many more coming. And my role is to ensure that the day-to-day research activities have the attention and support that they need from our multidisciplinary team. And I also often represent the Institute and its projects in conversations with stakeholders and collaborators. So if you'd like to connect further with the group, feel free to find me. I'm also fortunate to work closely with our faculty on projects, specifically on 2 exciting forthcoming manuscripts. The first describes national survey results of public perceptions around food as medicine topics, and excitingly, those results show broad support. And the other details the provision of nutrition information from online food retailers, which is becoming increasingly relevant as online grocery shopping continues to rise in popularity and offer solutions for equitable food access. So this has always been a really productive group, but with today's launch, it feels like we're really just getting started. So with that, I'd like to introduce our next 2 videos. Remarks by Chef Jose Andres, founder of World Central Kitchen, and United States Senator Cory Booker. Twice named one of Time Magazine's 100 most influential people, Jose Andres is an internationally recognized humanitarian, culinary innovator, New York Times bestselling author, educator, Emmy-nominated television personality, and owner of the award-winning Jose Andres Group, which operates nearly 40 restaurants in the US and beyond. In 2010, Andres founded World Central Kitchen, a nonprofit organization of food first responders, providing meals on the front lines of humanitarian, climate, and community crises. Most recently, following the Russian invasion of Ukraine, where World Central Kitchen has served hundreds of millions of meals in partnership with hundreds of local partners. Senator Cory Booker is the Democratic senator from New Jersey. As a member of the Senate Agriculture Committee, he has brought national attention to the importance of nutrition and healthy food access to public health and is a leader in transforming our food system. Now let's turn our attention to both of their remarks.
People of Tufts, people of America, here your friend, Chef Jose Andres. And it is my honor to congratulate Tufts University on the launch of the Food is Medicine Institute. There has never been a more critical time for this initiative. Food has too often been seen as the cause of many of the problems we face. When you and I know that it is an essential part of creating a healthier, more prosperous, more equal America. The progress that's been made in the lead up and the aftermath of the White House conference is real. But even greater is the opportunity that lies ahead of us for food and health to work hand in hand together as one to achieve the promises we've been dreaming of since 1969. It has been a privilege to work closely with many of you, but I want to take a moment to recognize one very special person. Derry, thank you for your friendship, for your leadership, and for always making me smarter, for connecting the dots. You make me proud to be a Tufts honorary degree recipient and a member of the Friedman School family. Earlier this year, I launched my own Global Food Institute in partnership with George Washington University. I hope that we will be close collaborators. I know we will, working side by side to change the world through the power of food. So on behalf of the George Washington Global Food Institute and the President's Council on Sports, Fitness, and Nutrition, congratulations on the launch of the Tufts University Food is Medicine Institute.
Good afternoon. I want to congratulate Dr. Mozaffarian and all the hardworking staff at the Tufts Friedman School on the launch of their Food is Medicine Institute. It makes me want to do a happy dance. I'll spare you that. But this is so exciting. All of you know that our nation is facing an extraordinary crisis of diet-related diseases. These diseases are now the leading cause of death in the United States. Half of our population now is pre-diabetic or has type 2 diabetes, and every month in our country, diabetes causes 13,000 new amputations, 5,000 new cases of kidney failure, and 2,000 new cases of blindness. This is a crisis, and we see it in other areas. Obesity is now the leading medical reason that 71% of our young Americans don't even qualify for military service. We know that nearly 1 out of every 3 of our dollars in the federal budget is going to healthcare spending, with 80% of this money paying for the treatment of preventable diseases. And these costs are rising and crowding out needed investments in everything from education to innovation in our government. This is a challenge for our country, especially if we believe in our ideals that everyone has a right to life, liberty, and the pursuit of happiness, none of which you can have if you are sick and facing diet-related diseases. So I have great hope, and you all are igniting my hope even more. Food is medicine. This is a movement, and you all are leaders. For too long, our medical system has undervalued the importance of high-quality food as both prevention and treatment for many serious chronic illnesses. But this is now starting to change. Effective food as medicine interventions like medically tailored meals and produce prescriptions are being shown unequivocally to improve health outcomes, reduce healthcare spending, and most importantly, elevate human well-being across our country. This momentum, this movement of food as medicine is undeniable. From medical section 1115 demonstration waivers to pilots on produce prescriptions in the Indian Health Services and the Department of Veteran Affairs. I could go on with the examples of people who are producing these little points of light, igniting these little examples of hope and promise and possibility. Now is the right moment for a Food is Medicine Institute to bring together research, patient treatment, and outreach. We can integrate this all into our healthcare system, and that's what has me so excited and holding back from showing you all that happy dance. Tufts, you guys rock. You've been at the forefront of this work for so long. I, in my office, have benefited from your expertise, wisdom, and guidance on policy, and that's why I'm even more excited that you're going to build on that leadership with this institute. Thank you. I am so excited to see this institute make meaningful progress in tackling what I believe is one of the greatest crises and urgencies that our country isn't talking enough about. This is not who we are. This doesn't even reflect our heritage. We cannot sustain these levels of food insecurity, of epidemic diet-related chronic diseases, of this starving of access to high-quality food. So, Tufts, congratulations to everyone at the Friedman School for all that you have done, for all the people who've contributed to make this a reality. You all are needed. It is the right work at the right time to face this challenge and make a better way forward. I am looking forward to what you all will do, your foot soldiers, in the movement for American ideals to liberate people from illness and sickness, to free people from fear and hurt, to help everyone understand that this is a nation that with all of its wealth should lead the world in human well-being and human flourishing. That is a noble dream, but you all are people who will make that dream a reality. Thank you for all that you do. I am excited about you, and I'm excited about our future together.
Well, thank you so much. We're running a few minutes over, and there's very little to add to the amazing talks, and in particularly the closing remarks by Senator Booker and Chef Jose Andres, as well as everyone else. So thank you so much for joining online. Thank you to everyone for coming in person. The reception is immediately to follow out here to your left. You can be shown that way. Really look forward to the conversations and the collaboration to come. Thank you so much.